Start the screen sharing. All right, for the people that already heard, pandemics through history, what we wanted to do in general was take a look at the past, Spanish flu of 1918, look at the present, sort of what is most pressing about this historically speaking, and a look into the future. You can see the names, and there we go. I'm waiting for,
Green light.
We're waiting for, perhaps she's not admitted yet. Eden?
Yeah, hey.
There we go.
Okay,
Sorry about that.
no problem. Okay, should I start?
Yes.
Okay, so general information about COVID-19. The origin was in Wuhan, China, and the first case was reported in November 2019. There's different theories of the origin as we researched the paper. Some think that it was man-made, some think that it was released from a lab, others think it evolved naturally from bats. We're not so sure yet. Different sources say different things, but the first case was reported in the US in January 2020, and the symptoms include fever, chills, cough, shortness of breath, fatigue, body aches, and nausea. General information about the Spanish flu. It originated in birds and it was caused by the H1N1 virus. The years were from February 1918 to April 1920, and there's different theories of where exactly it came from. Some sources say that it came from China, US, but it was named after Spain because of their neutrality during World War I, so it allowed them to report on their pandemic without any bias, unlike some other countries. The symptoms are very, very similar to COVID as you read: fever, coughing, night sweats, body aches, tiredness, nausea, and it's also spread through droplets. Both COVID and the Spanish flu are considered novel viruses, therefore. COVID spread in responses in the US. For COVID, it was said that one infected person would infect 2.5 to 3.5 people with the virus. From January 14th to February 23rd, there were 14 cases of COVID diagnosed in 6 US states, and that included 12 travelers from China, so it shows that public travel led to the widespread infections in the US. In late February, there were also cases of people who didn't travel, which really showed how much the virus spread. On January 24th, Fauci said that we don't want the American public to be worried about coronavirus because the risk is low. But on January 30th, a global health emergency was declared, and March 13th was the day Trump officially declared a national emergency. Large gatherings like church services led to the spread of COVID in the US. Different professional and social events led to the spread as well, like Mardi Gras in Louisiana, an international conference in Boston, and the introduction of COVID in nursing homes in particular had damaging effects. There were challenges at first with detecting the virus. Some think that it was very similar to influenza as the introduction of COVID was during that time, so it was hard for people to tell the difference. And there were also challenges dealing with limited testing. But during February was when they started to not allow travel from certain locations like Italy and China. And during March is when we were all sent home from college, and it's when there were a lot of closings of schools, non-essential workplaces were closed, and April 3rd was the day that the CDC officially said that people should wear cloth face coverings. So this data is from the site Politico, a credible news source, and March 24th was when things were starting to shut down. So it shows how states have different reactions depending on how hard COVID hit them at the time. For bars and restaurant limits, pretty much all across the country, dining establishments were closed to stop the spread. We saw businesses shift to shut down or takeout options, large gathering ban. Most states would ban large gatherings across the country to slow the spread. There are different meanings as to what exactly constituted a large gathering, but as time progressed and the virus worsened, they brought down the number of gatherings to 10. For mandatory quarantine ban, the states that were hit the hardest by COVID right away, like California, immediately had the quarantine order, but it hit Florida later, so that's why at this time only high-risk groups were quarantined. But as a whole, quarantine meant that everyone stays home except for essential activities like grocery shopping. Non-essential business closure. So most states ordered non-essential businesses to close while grocery stores, hospitals, and pharmacies were operating with strict guidelines. My question for you guys is, there's a lot of controversy regarding what exactly constitutes an essential business. Some states think that gun stores is an essential business. Some think abortion clinics, liquor stores. What do you guys think constitutes an essential business?
Are you able to hear me? Okay, good. I've been having some issues.
Okay, so Spanish flu responses. For the Spanish flu, it was said that one infected person would infect 2 others with the virus. The peak was in the second wave when the soldiers came home from war. In Philadelphia, the mayors told the public that there was nothing to worry about, so it showed that flu activity spread unevenly throughout the US as there were mixed responses. So, like I said, Philadelphia, they still had a parade because they thought that it was fine. It led to 2,600 deaths that week. St. Louis had a very different response. They shut down schools, movie theaters, and they helped flatten the curve. Other parts of the country, like California, followed suit and mandated masks like today. So yeah, this chart just does a good job showing what I said. Philadelphia led to an increase of the cases in the US, and St. Louis helped flatten the curve. Okay. So population and age demographics. The Spanish flu mostly affected 20 to 40-year-olds, but COVID mostly affected those who have underlying conditions like heart diseases, diabetes, or the elderly. Originally, people only thought you could catch COVID if you fell under these categories, but then it was understood anyone could get it, and it's hard to predict how someone's going to react to it. But as the chart shows, usually younger people are more able to recover from COVID. So my next question for you guys is, how would the reaction to lockdowns have been different if COVID affected younger people like the Spanish flu did? People think teenagers are the ones not following guidelines, not taking COVID serious. They're hanging out with their friends at college campuses, leading to outbreaks. Do you think they would act different if COVID targeted them and not the elderly?
So next, I'm going to go over the waves of the Spanish flu. So in the first wave of spring 1918, cases were high, but mortality was not. And the Spanish flu was considered relatively mild. In the second wave of fall 1918, the pandemic was highly contagious and responsible for most of the deaths in the US attributed to the pandemic. So this is due to failures in public health policy, shortages in medical personnel, and the mobilization of men across the country to join the war. The third wave was from winter 1918 to spring 1919. And it is said that just as the war affected the Spanish flu affected the war. So entire fleets were infected and men on the front lines were too sick to fight. An estimated 675,000 Americans died of influenza during the pandemic, 10 times as many as in World War I. So of the US soldiers who died in Europe, half of them died because of the flu. So this graph shows the weekly combined influenza and pneumonia mortality in the United Kingdom from 1918 to 1919. So this parallels the trends we see worldwide during the time. And although there is a question to the credibility of the data, because of the nature of data collection at the time, it wasn't as accurate, it does give us our best estimates. So next we have waves of COVID. So due in large part to the variation in COVID guidelines, how hard and when urban or rural populations were hit, as well as the reopenings of schools and businesses, The waves appear sort of like a patchwork quilt or regional surges compared to a uniform wave across the country. So the first wave was around April and focused in the Northeast, especially New York. The second wave hit around mid-July in the South and West, like in Florida, Texas, and California. And the emergence of new cases right now has led many to believe that we are experiencing a third wave. So we've seen an increase in cases in the Midwest, as well as a reversal in the age range, with many young adults testing positive. What is especially worrisome is the convergence of COVID fatigue, as people tire of abiding by social distancing guidelines and want to return to their life pre-COVID, as well as the flu season, colder weather bringing people closer together indoors, and the holiday travel season coming upon us as people go home and travel for Thanksgiving and Christmas. Next, we have a graph about county differences. So it shows new cases by the county size. And what's really interesting to note is that the 62 largest counties were responsible for most of the cases for the first two waves. But right now, the smallest counties are leading the charge in the third wave. So one possible explanation is that these smaller, more rural counties have a wider range in COVID guidelines, with potentially lower adherence towards wearing masks or socially distancing. Here's my question for y'all. What are some other possible explanations for this change? Next, in this graph, we see the mortality of COVID-19 compared to past US epidemics. So this scenario is based on 1 million COVID deaths, and the virus kills more Americans than past epidemics. But when population size is accounted for, the Spanish flu is more deadly. So taking into account years of remaining life, the study calculated that the Spanish flu resulted in even larger losses. However, this graph was taken from a study published in August this year. So as COVID isn't done yet with the third wave upon us, do you think it's possible for COVID losses to surpass the Spanish flu losses? Why or why not? And then next, I'm going to be comparing the medical infrastructure. So during the Spanish flu, there was a shortage of medical workers, and this is because it overlapped with World War I. So most doctors were busy helping the troops, whether abroad or at home. And we've also seen shortages of medical personnel during COVID as cases surpass hospital capacities. So both the Spanish flu and COVID saw medical students graduating early to help with the deficiency in doctors. During the Spanish flu, there were also no vaccines or antibiotics available, and doctors were unsure of how to treat it and believed aspirin to help. Unfortunately, they later realized that it accelerated their deaths. So they mostly depended on non-pharmaceutical interventions, such as social distancing, hand sanitizer, and wearing masks. Similarly, we also don't have a COVID vaccine yet, although hopefully one's coming soon. So similarly to how doctors attempted to use aspirin to cure the Spanish flu, we also discovered that hydroxychloroquine was proven ineffective. But our doctors do have a variety of treatment options due to the advancements in our medicine and technology. So such as antiviral drugs such as remdesivir or steroids such as dexamethasone.
Hey, so this next section is mine, and I'm most interested kind of in the social and political ongoings of the two pandemics, how they differed, how they were similar, and kind of the effects therein, and what it could mean, and whether we can learn from the Spanish flu. So obviously, as has been touched on, both pandemics were highly politicized. COVID-19, we've seen that very prominently from Trump, with his influence, refusing to wear a mask, tweeting pretty frequently on unsubstantiated claims with regarding COVID. We've also seen the emergence of a kind of a loud minority on the right. Um, Media played a role with the Spanish flu, but of course it's playing a larger role with COVID-19, just in terms of its scope and its reach. In both pandemics, you did see this kind of this you did see mask wearing as a politicized thing in itself that was representative of a larger political and social divide. Kind of this, as it's manifested in during COVID, the health versus economy debate, which in itself is kind of, probably a political weapon intended to divide and intended to pit people against each other. With the Spanish flu, which I think this was mentioned, but the term Spanish flu was an inherently political term in itself. Spain was neutral in World War One, and it's very temporally revealing that they chose to call it the Spanish flu, or that it's known as the Spanish flu pretty colloquially. It's largely due to Spain's neutrality, and it's also due to a general distrust of media and reporting. World War One was obviously ongoing, and a lot of countries feared that other countries would use this virus as a political weapon, either to harm other countries or just to falsely report statistics. We saw kind of this same fear-based international politics with China and the U.S. towards the beginning of COVID, and then mask wearing again with the Spanish flu was kind of seen as an anti-masculine thing. A lot of men refused to wear it, and it took it took a lot of media and attention from the U.S. government to turn it into actually a patriotic act to wear your mask to help your country win the war and to kind of be a man. That's it for this slide. Yeah, thanks. So I wanted just to briefly talk about the winners and the losers of the two pandemics. I have winners and losers in quotes, for reasons that should be obvious but maybe aren't. I think I want to hesitate to call anyone like losers in the pandemics, because what I mean by that is really those who are most affected or who suffer the most. Winners, are people who I guess indirectly benefit or maybe more directly benefit. With the Spanish flu, obviously, it did have an impact on the outcome of World War One. There was towards the end of 1918, there was a large German offensive going on that was really thwarted by the Spanish flu, and it, of course, it hit French troops and British troops and U.S. troops as well, but they kind of had the advantage of being in a defensive position. I included radical European politicians as potential indirect and kind of later winners of the pandemic, but I'll get into that more in my next few slides. And then we did see a couple public healthcare systems in the international arena that were born of the pandemic, most notably with Lenin in Russia, but other places as well. With COVID, the winners are maybe a little more obvious. Big business and tech has really benefited from the pandemic. We've seen the pandemic just as kind of a general accelerator of all trends. Wealthy suburban areas have benefited just in terms of safety and not being hit as hard. And then, of course, online platforms kind of goes along with tech and big business. I included educational institutions, and I added a question mark because I think it's up for debate. But and we did just have a little discussion in the chat a couple minutes ago when that question was raised about our schools, businesses, and I think a lot of educational institutions are going to hurt from this pandemic, but a lot of them are definitely going to benefit. It's cheaper to have kids study remotely, and a lot of schools are doing that now. Again, just briefly, the losers, those most affected by the pandemics. Of course, I think first and foremost, it's important to note that it's it's those that die from the pandemics are the most affected. So that's, the 500 million infected and the 50 million that died in the Spanish flu, and the 40 and a half and counting million that have been infected by COVID, and the a million plus that have died. Again, World War I soldiers, which, were hit really hard. Obviously, they were in the trenches together. They were on boats together, as we talked about the U.S. soldiers. And that kind of made me wonder about a lot of the statistics we've seen with the Spanish flu. How it affected a much younger age demographic than other influenza epidemics, and COVID definitely. And whether those statistics are skewed just by the fact that there was a world war, the Great War, waging that was primarily carried out by age 18 to 30-year-old males. A couple other kind of places hit hard. The Philippines were occupied by the U.S. At the time, and it was really not. Guidelines weren't enforced, or there weren't restrictions put in place, and the Philippines was hit hard. Doctors, their reputation was hurt, and kind of just non-wealthy people in general. There were fines that had to be paid if you weren't abiding by the flu ordinances. With COVID, we've seen cities hit really hard. Workers that can't really transition to any form of remote working. Obviously, the travel industry, small business. I would argue that students are hit quite hard. And then just, kind of demographically, minorities and lower income groups have been definitely affected by the virus the most. So, where I'm kind of getting with all this, the whole compare and contrast thing, is to talk about kind of the phenomenon of the two eras that are similar and maybe different, and what that might look like for us in the next 5 to 10 years. I think both eras were characterized by some strong leftist movements, even some revolutions. Obviously, with the Spanish flu, that was the first Red Scare. You saw, Bolshevik Russia. You saw the Spartacus movement in Germany, and a couple others. And today, I think a lot of social upheavals and kind of progressive movements have come to the forefront and have become more outspoken. And of course, with that, in both eras, you see a lot of counter revolutions on the far right, and we saw that obviously across Europe, and most notably in Germany. And then we're starting to see that. Hopefully, it's just a smaller, louder, but less serious minority in the U.S. But it's still something to note, and I think. Also, something that's important to note is that none of these things are direct causal links of the two pandemics, but I would argue personally that pandemics do contribute to a kind of an underlying sense of uncertainty that then kind of drives fear, distrust, and I then think that democracies and countries and populations are then more susceptible to movements, to radical thinking, to political change. And we've seen this kind of in all arenas. We've seen this as kind of the questioning of the U.S. democracy as unstable. We have an upcoming election that's, I think, going to prove really, really revealing and maybe startling. Hopefully not. And in both eras, the media was kind of characterized as a little bit untrustworthy. Again, we saw that with the whole terminology of Spanish flu, and we see that definitely today with fake news. And I think kind of just like conspiracy theories in both eras become more mainstream, become more of a typical narrative. There's this idea. I think people feel so uncertain and they feel so unstable that they'd rather accept that there's some conspiracy theory or some group of conspirators that are controlling things than to accept that the world is out of control and there's nothing they can do. I think that in itself is one of the most one of the scariest and most destabilizing things for humans. I think people cling to conspiracy theories as things that actually ground them, albeit things that ground them in, you know, hatred and fear and whatever. And then kind of, you know, as, you know, something that brings all this together, you know, just the idea that the flu is a very foreign thing. We saw that with Spanish flu. We saw it with Trump's calling it the China virus. We've seen kind of both the pandemics heighten international distrust. Obviously, with the Spanish flu, it's more understandable. It was coming out of a world war, the war to end all wars. Now it's not as understandable. It's more driven by individuals and groups. But I do think that this idea is that the flu is foreign and as kind of spiking that international distrust does allow for kind of a general crisis and hysteria. And it also contributes to nationalist fervor, which is, I think, particularly dangerous in times like these. So I wanted to just end with a quote from Professor Gerard de Groot, and it goes, "In times of crisis, the public prefers prejudice to dispassionate, rational analysis. Our current hysteria might differ in its manifestations to that of a century ago, but not in its intensity." You know, I think that kind of sums up this section well, and it also kind of sums up the reason I think many of us are taking this class. We've seen so much hysteria and crisis and prejudice come out of this pandemic, and we saw it 100 years ago, just in different manifestations. And of course, it's, you know, it's important just to kind of at least try to, you know, put that aside and engage in rational analysis. So I guess discussions off that, you know, of is our democracy threatened? You know, what are the progressive movements and the counter-revolutionary movements, you know, look like in the next 5 to 10 years? Do they replicate or mirror any of those that we saw in Germany 90, 100 years ago? And is our democracy unstable? Food for thought, and we'll move on.
Thank you, Eden, Peter, and Kayla. Okay, indeed, there's many ways to look at this pandemic. You know, we see the winners, losers, you know, who writes the history. But at the end of the day, when we have our kids or grandchildren coming to our home asking us about the coronavirus, it will be politics that has told this story. That is the most important thing. Again, the pandemic response, we can have many different opinions about that, but I believe that's something we can agree on, is that news coverage has been rather politicized, rather polarized. I actually want to get through these slides a little bit quickly to get to the information. I don't want to run out of time, but I want to draw the metaphor of information as the virus. Not only does it spread so much quicker than the coronavirus, but it mutates. We have a piece of information arriving at someone, they change it, you know, according to their beliefs and opinions and biases, and they spread that information once again. And it should be noted that it is information that drives action. And as of now, 2020, it is information that drives the functionings of a successful democracy. So then the question is, okay, how do I quantify human opinion? So the first step was we started with a scholarly article. The name is there. Basically what it did is it sort of measured the initial response from the New York Times and the Global Times from China. And we saw right away, we saw very quick politicization of these, of the pandemic. You know, the US criticizing the communist government of China, China criticizing the lack of transparency from the US government. What this article did, it sort of did a critical discourse analysis of these of the articles, and we see it was inspired by a Dutch scholar, Van Dijk. I want to go over the schemata. overall. Macrostructures talks about the headline, the big text. What is it that draws the attention of the viewer, whether it's an article or a video? Then come the superstructures. We go a little bit down the hierarchy. How is it organized? What's the introduction? Where's the conclusion? How much substance is in the article or the video? And at the end, we have the most subtle ways of measuring polarization, politicization in an article, which is the presuppositions, the implications, suggestions, all those little tricks of rhetoric which matter. Now, the plan became, okay, I want to make a survey. I want to, I have a starting point, but where do I go from here? Information is not an isolated experience. It's contingent on what we've learned before. So my goal was not to have any other goal, not to have a goal other than to just know what people are thinking, right? I want, as you can see with the questions, I was asking people to measure the news coverage of each month from 1 through 6. And it was interesting to come up with the opposite of politicization. So I focused on the term of uniform, of the feeling that the information that you're receiving is overall cohesive with other sources. I had to be very careful with the wording of the survey, but I think most important, I want to show you the results, which I think are quite interesting. So again, it's not random. We can see that very quickly, and I added some arrows for dramatic effect. There is a trend. There is something to say about this, and let me just explain the units very quickly. As you can see, the vertically, it's 1 through 6. I took all the I added up all the numbers, all the grades for each month, and I took their average being the number of responses. On the left, we see the responses, how much was students, how much was former students. And so we can see there are different projections to be drawn. There are different, very different, many things to say about this, actually. From May to June, we see what was most interesting to me was this sort of presence of oscillation. You're taking something as abstract as human opinion about news, politicization and news coverage, and you see a pattern emerge, which I think that was one of the most interesting things. We see it down and up, makes us wonder what will happen next. Now, we can interpret it in many different ways. Linear regression, we learned about that, sort of the general overall trend. Now we see a quadratic line of regression, a little bit more accurate, but take notice at the projection of the future, right? And again, cubic regression, you see a little bit more accurate. We're getting a little bit closer to what we've seen. And then we have to the 4th degree, a line of regression, and we see a much more accurate picture. So, at the end of the day, we can put them all together, but it should be noted that, math cannot account for every variable, and especially something as a tool as simple as line of regression. So it makes us wonder what could happen, as Peter said, with the elections, as things become a little bit more intense, what could happen. So just as a prediction, I think it's a good guess in that green area. Let me just show it once more. I think we can expect to be somewhere right there. Now, very important. It's not only a question of what data is shown, what numbers are shown, which numbers are concealed. It is how they're shown. And so I wanted to show you this, a completely different way to visualize the same data that I just showed you. But here it's so much clearer, and maybe it just shows a different picture, right? We see right here what we see is for each month. Let me explain. So we have from January all the way to October, and then after that it's what people think November will look like. We see the distribution, basically the ratios. How many people graded it at 1, 2, 3, and so on and so on. And so I wanted to ask people, bring it up to conversation. What does this graph show us that this one does not? If anybody wants to add. Very well. Okay. Obviously, there has to, many limitations, many flaws. Anything from the survey itself. Maybe I was suggesting something, maybe didn't do a very good job. Maybe 1 through 6 was not the best number. We can go on and on about, what are the flaws. And I also want to invite people to tell me if they see any flaws in the survey. You know, there's so many possibilities to make mistakes in these things, right? As we have seen, is not only how we show the data, you know, it can go wrong in so many ways, right? This sort of collection and display of information. Now, we didn't have a lot of responses. No, unfortunately, I sent like 200 emails. But is this significant? Should we care? You know, should we have a notion of collective wisdom? You know, the sort of thought that when you take opinion or estimations from a large group of people, you get closer to the truth. And so we have a lot of, you know, we can draw many different conclusions. You know, I guess the biggest one is, what does this mean, right? We see a growth in the people's opinion of politicization. And I believe it can lead us to say that there's a growing mistrust, especially now it has been exacerbated by the pandemic and by the federal government response. And, you know, again, I want to stress the fact that this is not random. We see the shift on the left with the purple graphs, and then the other one. You know, we could have had people not feel like the politicization was increasing because they became desensitized or for whatever reason, but no, we still see an increase, right? This survey set out to measure politicization, but maybe it can tell us something more. You know, is this right? Should we, as a democracy that's supposed to work with information, with truth, with educated opinion, you know, should we be worried? Should we be saying something to these news networks, you know, to provide people with a more cohesive narrative of the information? You know, of course we can ask how the news will change as a medium, you know, what these anxieties of misinformation will do, what to expect from the future. And I will talk about this in my other presentation with the economics group, dig a little bit deeper about the information, but I want people to think about this. What does it mean to be entitled to the right information in the information age? And do we have a right to correct information? Thank you. Emma?
Are you able to hear me?
Yes. I'm waiting for Emma to pick up the presentation.
Can you hear me now?
There we go. Okay.
Okay, I'm so sorry. I don't know what that was. Thank you guys. And thank you, Isaac, for that data. Before we can clearly understand the politicization of our current pandemic, I think it's important to think about how the spread of news coverage has changed in the last 100 years. So as Isaac mentioned, and many others, we're currently living in a global information age, wherein many citizens feel entitled to immediate updates about world events online and digitally. Our own, I guess, coronavirus dashboard that Williams College updates, whereas about, can you still hear me? Okay, sorry, thank you. Whereas about 100 years ago, most private citizens learned about world updates through print newspaper sources only. So we did not have the constant 24-hour news cycle of today. And this obviously changed the way that people found out about these two pandemics. Okay. I'll try to speak even more loudly so everyone can hopefully hear. So regardless of how quickly information was spread during these two pandemics, it's clear that there is some degree of suppression of this news coverage that is a commonality between the two. So for example, in something I didn't know and recently learned is that in April of 1919, during the Paris Peace Conference in the wake of World War I, our own President Woodrow Wilson actually contracted the Spanish flu. His aides and advisors told everyone that it was a passing cold and covered it up, so his diplomacy would still be seen as strong and he would still be taken seriously. Also similarly, a few months before, in September of 1918, 3 months before the official close of World War I, the United Kingdom Prime Minister David Lloyd George at the time also came down with the Spanish flu, and that was also covered up so that his own citizens wouldn't find out, essentially. And so these two events on the highest level of national leadership at the time exemplified the suppression of accurate news coverage after and during World War I. Also during World War I, nations often covered up their true case reports so as to boost the morale of their own citizens at wartime and also to appear stronger to enemy countries. So if we're going to think about how this compares to today, of course there is a difference in that when the current UK Prime Minister and our own President both did have the coronavirus, we were able to track that as a world. We were able to find out through our global media their updates. However, there still have been allegations of at least some level of suppression or misinformation that's intentional about true case reports across the world for many reasons. So now I guess some food for thought, some questions that I'll quickly pose. Is our media coverage more or less politicized than coverage of the Spanish flu? And how might these trends change in the future? So now we're going to look at how these historical and scientific views of the past pandemic and our current pandemic could help us prepare for the future. Thank you.
So what did we learn from the Spanish flu and how can we apply this to the future? Well, the Spanish flu taught us that crowd control works, so practicing social distancing does help stop the spread. The Spanish flu also taught the public that masks do work and reinforced the ideas that vaccinations are also effective and necessary. Recent pandemics, for example, the swine flu, have reinforced these same ideas and taught us new lessons. For example, we've learned that we needed to combat the lack of space in hospitals, which is one of the reasons why the flatten the curve ideology is so important. Furthermore, other infections have taught us that we need to practice good hygiene, we need to wear masks, use hand sanitizers, and take other preventative measures to help the population. So based on this information, were we prepared to handle COVID-19? Well, there isn't a clear answer, but there have been several simulations that have been run over the years to try and predict what would happen if there was a worldwide pandemic. One of these is notably Event 201. It was held in 2019. It ran a simulation of a hypothetical coronavirus, and it was organized by experts from numerous fields. And they decided to try and run a simulation to see what the worldwide effects of this virus would be. So quickly, these are just the parameters that they consulted in order to come up with their results. They had to decide on a fatality rate once hospitalized, an incubation period for their hypothetical virus, and they used this model to then predict their results. So the simulation estimated that there would be 65 million deaths worldwide in 18 months. However, this was viewed even by people within the simulation as an overestimate. They predicted most affected countries would be lower middle income and that there would be financial turmoil and societal impacts for decades. Now, these simulations don't create policy, they simply result in hindsight, and they're not always completely accurate in what they predict. So this simulation predicted the US would not be hard hit by their hypothetical virus, yet it was with COVID-19. So it is important to understand and learn from these simulations, but we be aware that there is often a greater picture than what they predict.
Hi, so I'm going to be talking about what lessons we can learn from COVID-19, especially as it pertains to the US health infrastructure, so that we can be better prepared for a future pandemic. And just in general, the pandemic has shown us how ill-prepared the American health infrastructure is, especially in those crucial early days when containment of the virus was so essential. And so I'm obviously not going to have this really large, very detailed plan. I'm going to be discussing a couple of what I suspect to be the most salient issues when it comes to the US health infrastructure, and just see how we can be better prepared for a future epidemic or pandemic just based from what we've learned from COVID-19. And so the first thing you'll see on your screen is improved testing, and testing, as we know, is really essential. It's essential because it helps us understand the scope of the pandemic, the extent of community spread, and it helps leaders make policy decisions. So if we know the amount of community spread we have in a country, we can know whether or not we need a mask mandate or whether we need national lockdowns. So if we implement robust testing early, governments can make the wisest decisions about what measures are the most necessary for their country to contain the virus. So throughout this presentation, I'll be comparing the US to a lot of different countries that I think did a really good job in certain areas. So in this part, we'll be comparing, for example, to South Korea. South Korea implemented robust testing very early, and over here you'll see an infographic about what their testing procedure evolved to look like. They didn't start off perfect, but they worked up to a drive-through testing model, which is very important because it was very accessible for people. Eventually, they have a walk-in testing model, sort of like the one we have at Williams, so that people who don't have the income to own a car can still have a low-contact, low-cost rapid testing center. So I thought that was a very interesting way we could go about it. And if we have robust testing, we can also do something like New Zealand did. So as you'll see in the screen as well, New Zealand has an alert system with different levels. It has 4 levels. And just based on the amount of community spread, they know whether to implement certain social or governmental restrictions. And so it's very good and dandy that I tell you that we need to have robust testing. So how could we actually implement this? Well, based on what I've read, to have an effective strategy, there needs to be a federal effort for control of the tests and the frequency of them. And some even suggest that the federal government should buy the tests themselves and then distribute them at the desired frequency. Others say that we should have an online marketplace, which is a very interesting idea that would detail all the available resources for testing sites of any of the sizes or area. Actually, can you go back to the other slide, because I wasn't really done yet? Because mine says that you moved on to the next. That's for you guys as well. Thank you. And so next is contact tracing. Sorry, I'm going to just move my screen a little bit. Sorry. Okay. So when it comes to contact tracing, it's also really important because it is an ideal way of potentially limiting the spread of infectious diseases like COVID. But the US obviously had, its effort with contact tracing was not as good as it could be. The US currently has an underfunded, undermanned system of contact tracing that varies a lot from state to state, so it's not really that uniform. And so the US cannot currently rely on this proven effective method of helping sort of contain the spread of the virus. So if we had a robust system like maybe Germany or South Korea has, the US could probably be in a better position than it is right now. So the National Association of County and City Health Officials is like the acronym you'll see over there, has calculated that given the current amount of US cases, the least amount of contact tracers we can have is 100,000, which would cost federal, state, and territorial governments about $3.7 billion. Of course, we do have more cases than when the study was made, so it is possible that we would need more, and therefore that would cost more money. And ideally, when it comes to who these contact tracers would be, it does involve a lot of training, but they should be members of the hardest hit communities, and they should be speakers of a variety of different languages, because that way they establish trust with the people that they're trying to communicate with, and therefore it makes them more likely to actually get the intricacies of people's interactions throughout the day. And so how would we establish contact tracing? Well, we saw a lot of efforts in Germany for virtual contact tracing. There were a lot of issues with that. So what I've read does not propose to go to a full virtual model. We will need manual contact tracers. That does entail a lot of training, but it's not impossible to do. But we could have manual contact tracers be supplemented by tracing apps, which are very interesting. They usually rely on Bluetooth. There's a lot of studies on that if anybody's interested. And there are security concerns. So companies like Google says that the app would be voluntary, would only inform people that they have been exposed, but they wouldn't say who would have exposed them. So that wouldn't reveal any patient information. They would have all sorts of security measures to protect information, and the information would only be stored for the length of the pandemic. So I thought that's just like a very interesting thing. You think you can move to the next slide, please? Perfect, thank you. So another thing that's really important is nationwide collaboration. So we saw that New York faced an acute ventilator shortage in the height of the first wave. But since we didn't have a comprehensive plan for attaining and distributing those resources, like ventilators and PPE, the state had to compete with others for access to these life-saving resources. And so I have this quote from Governor Cuomo of New York from April that I think really highlights the situation. It says, I bought 17,000 ventilators, ordered 17,000 ventilators from China. But I think what's happening is that when somebody else outbids you, your order is just gone. I haven't even received 1,000. So as you can see, because he had to compete with other states, he couldn't really get access to them. And so this situation, the fact that they have to compete, also means that larger states with larger economies, such as California, for example, have an advantage because they can outbid their smaller state counterparts. And if we had instead a singular national plan, the states could allocate these resources where they are most necessary without the need for the states to compete. And the CDC has set up guidelines for how they would allocate these resources. And there's this link right there. I would go over it, but I don't want to go over our time. Other than that, another really important thing so that we can be prepared for the next pandemic is surge capacity. So as we know, COVID-19 usually comes in spikes, and that can really test hospital capacity, and that can be incredibly dangerous. So hospitals in the US should be better prepared to handle such a spike by ensuring they have what is called surge capacity. And they should, because we need to finish up, I'm not going to go over the details of this, but there's the Hospital Survey and Construction Act of 1946. It's just like, it's an ideal way of funding it. We would, instead of building new facilities, we would just reconfigure the ones we already have. And it would cost instead about 75 billion, which is a lot less than it would cost if we just built new facilities. So you can go to the next slide, please. Super. So I know
we're over time and we have people who have classes, so you need to wrap it up.
Okay. Well, just that COVID pandemic has also highlighted that there are a lot of failings with our current infrastructure system for healthcare. Maybe universal healthcare could help mitigate one of these problems. If anybody is interested, I do have the information that would be on this slide. Other than that, you can, so basically it's just if you have insurance that is tied to your employment status and you lose your job because of the pandemic, it would be really expensive. We'd have your numbers on the screen. So it's just maybe universal healthcare would be an interesting way that we could circumvent that problem. You can go to the next slide.
We need to stop now, so thank you very much. I will leave this slide up so that it gets recorded. Have a great day all.